Hello everyone, welcome to this PowerPoint presentation on health information management. This slide talks about bias and prejudice and the negative impact on healthcare culture. As you see, bias is defined as having negative inclination towards someone, individuals or something. On the other hand, prejudice is characterized by preconceived and unfavorable opinions influenced by inadequate evidence and stereotypes. These concepts have severe negative effects on the culture in healthcare organizations because they impair interactions and decision making. They could influence variations in treatment, delayed service delivery, and misdiagnosis. For example, when care providers prioritize clients' initial presentation instead of their actual health needs. As a result, this leads to the lack of trust between patients and physicians and makes it challenging to create a positive and inclusive culture. This slide talks about how application of the AHIMA Code of Ethics can help mitigate bias and prejudices. The American Health Information Management Association Code of Ethics would help to prevent bias and prejudices because it provides a framework for making ethical decisions. This would ensure that healthcare providers observe responsible conduct by promoting fairness, respect, and equity in care delivery. The code specifies the processes that should be used when reporting and addressing unethical conduct, like discriminatory practices among care providers. It also emphasizes the need for observing patients' privacy and confidentiality and ensuring transparency and accountability, especially when compiling health information. This would ensure that data reflects objective patient experiences without introducing biases. This slide explores the 6 purposes the AHIMA Code of Ethics serves. The primary purposes of the AHIMA Code of Ethics include ensuring the observation of high standards of practice in healthcare information management. The code also specifies general ethical principles that should be observed as core values in the profession. It also specifies the ethical principles that should help in guiding actions and decisions. The code provides a framework for guiding professional behavior and responsibilities, especially when facing conflicting professional obligations and ethical dilemmas. The AHIMA Code also specifies diverse ethical principles that members of the public can use to hold health information management professionals accountable. It also serves as a tool for mentoring new practitioners of the mission, values, and ethical principles associated with health information management. The AHIMA Code of Ethics principles that address ethical and cultural issues. This is the 13th principle of the AHIMA Code of Ethics. It addresses cultural and ethical issues because it requires care professionals to respect all clients. The principle requires care providers to respect the inherent dignity and worth of all individuals. It requires them to have awareness of individual differences and cultural and ethnic diversity. It also requires them to respect self-determination for all individuals and to treat all people equitably. This includes ensuring that all voices are heard and respected. There are also wider cultural and ethical issues addressed in other principles. The first principle addresses ethical and cultural issues related to data privacy and confidentiality. It requires healthcare providers to observe clients' rights to privacy and confidentiality, especially in using and disclosing their data. The second principle also addresses ethical issues relating to avoiding biases and prejudice. It requires care providers to prioritize clients' welfare and health before their self-interests. The second principle also echoes the values advanced in the eighth principle that requires care providers to observe professional behaviors to enhance the reputation of the health information management profession. The fourth principle also addresses ethical issues by requiring professionals to avoid engaging in unethical practices or concealing them. The fifth and sixth principles address ethical issues about data usage. They require care providers to advocate for and use data technology and other information resources appropriately within the healthcare ecosystem. The third principle of the AHIMA Code of Ethics is one of the selected ethical principles. It focuses on preserving, protecting, and securing personal health information and confidential data while considering relevant laws and statutes. This principle promotes the use of patient-centered care as it requires professionals to implement adequate measures to ensure that health information is stored securely and protected. This will prevent it from being hacked when it is being transmitted, transferred, or disposed of. The principle also promotes patients' rights as it requires professionals to inform clients about the risks of delivering services through electronic or social media. This allows them to take adequate measures to safeguard their data, which enhances their safety. Another ethical principle that was selected is the fifth principle. It requires care providers to use data, information resources, and technology as intended within the confines of organizational policies. Therefore, the data and information acquired from diverse technologies should not be used outside the scope of the job. The principle promotes patient-centered care as it requires care providers to prioritize client interests. It also promotes patients' rights related to privacy and confidentiality of their data. This would enhance patient safety and prevent health information management professionals from compromising data integrity intentionally or indirectly through acts that increase the risk to data integrity. Another selected ethical principle is the sixth principle. It focuses on the advocacy responsibilities of the health information management professionals to ensure appropriate use of information resources. It promotes patient-centered care by requiring care providers to verify data and information requests. This would ensure the requests are made for appropriate and verifiable processes aligned with organizational policies. The principle promotes patient rights by requiring care providers to educate individuals about data integrity and the potential effects of compromising it. This principle also safeguards patient safety by prohibiting care professionals from manipulating information systems to generate misleading data intentionally. One of the real-world ethical issues that could occur in the physical and virtual work environment is intrusion and hacking into databases. This issue occurs especially after violating the ethical principle related to using and advocating for the use of data, information resources, and technology appropriately. This results in actions that increase the risk of data integrity. For example, failing to verify data and information requests and manipulating systems to generate misleading information. Various measures could be taken to enhance the ethical principles and create a positive and inclusive work environment. They include limiting accessibility of data outside the scope of the job, for example, by utilizing passwords and firewalls. Professionals should also verify requests for data and educate clients on how to maintain data integrity. Another real-world ethical issues that could happen in the physical and virtual work environment is discrimination against whistleblowers. This issue violates the ethical principle of This issue violates the ethical principle of refusing to engage in unethical practices and reporting them. The measures that could be taken to enforce this ethical principle include using the AHIMA policy and procedures for disciplinary review and appeal when reviewing possible ethical complaints. Professionals should also seek a resolution for potential unethical actions. They should also consult with their colleagues to ensure that they take appropriate actions through formal channels. That is all for this presentation. I hope it was informative about health information management. Thank you.